pleasure to share this case with all. My name is Wang Zimeng. My partner is Zhou Fangzhu. On January 28, 2022, just 3 days before the Chinese New Year, the department is still very busy. Suddenly, a critical value appeared on the screen. Hemoglobin was as high as 200. So we immediately reviewed the medical records of this patient. It displayed that the male was admitted to gastroenterology department because of dry mouth, without obvious causes 1 year ago. We checked the patient and the medical advice and found only this blood routine examination was ordered. Let's review the key points. The young man has no previous history of acute or chronic disease. Dry mouth with an abnormal elevation of hemoglobin. Looks like dehydration. Dry mouth for 1 year. Diabetes. DKA. Then we use the POCT glucose meter to detect this sample immediately. The detection result showed the glucose concentration reached up to 24.5. I contacted the outpatient doctor and told him about this. Transferred the patient to endocrinology immediately. Then I called the patient and urged him to see doctor at once. The patient is skeptical of the condition. Besides, he sounds really tired, which proved my suspicion. After 20 minutes, this patient was referred to the Department of Endocrinology. The detailed case data shows that the patient lost about 15 kilograms 1 month ago. 10 days ago, he developed dry mouth, accompanied by polydipsia, polyuria. 2 days ago, the patient vomited, accompanied by dizziness and fatigue. We can see his POCT glucose up to 27.3, ketone 4.4. After admission, we can see his symptoms were a little more than 3 disease, and his glucose was still rising. We supplemented other relevant tests, which shows that the patient was in metabolic acidosis, also a critical value. However, it improved after treatment. Let's review the whole case. At 9:48, this patient was drawn blood with 1 hour. He was referred to the correct department and last diagnosed with type 2 diabetes and discharged after 1 week. Throughout the whole process of medical treatment, the laboratory not only plays an examination role, but also provides a direction for clinical diagnosis. Now, let's look at the background and clinical cause of the case. The increase of hemoglobin can be divided into the following 2 parts. Physiological increase caused by dehydration, plateau, and newborns. Pathological increase, cancer, cardiogenic. At the same time, we should also be alert to form elevation of hemoglobin derived from such as an acute pancreatitis infection. What about diabetes? In the early stage of diabetes, the patients always present with dry mouth, fatigue, or dizziness. Because diabetes can bring systemic complications. Polyphagia, polydipsia, polyuria, and emaciation, so as called a little more than 3 disease, which often has a non-early stage of diabetes. Although this case is simple, the patient's visit time was shortened greatly. Nowadays, higher requirements are put forward for laboratory physicians to realize the close combination of laboratory results and clinical practice. Enrich training of clinical thinking, which can provide high-quality service for patients. And last, thanks for IFCC and Merit, and thanks for our department and my partner. Wish you all good health. Thanks.